Today's MCQ, all of the following are systemic conditions which are associated with keratoconus except. So if you have marked the answer as congenital syphilis, awesome, you are absolutely correct. So basically in keratoconus, the cornea is going to become cone shaped because of the stromal thinning of the cornea. So that is related to ophthalmology. So what are those conditions which are associated with keratoconus is also very important. So as you can see, these are all the causes here. The first ones are the ones which are hardcore ophthalmology topics. So the last ones are having some relation with the dermatology. So just see, the rigid contact lens usage or chronic eye rubbing can cause keratoconus, and also Down syndrome can cause. And as you can see here, atopic diseases, that is atopic dermatitis, these patients also can have keratoconus. Marfan syndrome, Ehler Danlos syndrome, and osteogenesis imperfecta. So in all these conditions we can see the keratoconus. So you might be wondering what will be the congenital syphilis and its eye features So you must remember that two kinds of the congenital syphilis manifestations can be noted if the changes are seen within 2 years of the childbirth, then we call them as early changes, and those which are seen after 2 years are called as late features. So in the early as well as in the late features, there are two things which are going to be common, that is uveitis and glaucoma. These two will be common for both early and late, but in early congenital syphilis, the features which can be seen very characteristically are the involvement of the chorioretinitis. Chorioretinitis can be seen, this is important. And in the late, so I don't want to tell the name of that completely, but it's a question for all of you. A special type of keratitis can occur in late congenital syphilis. So if you know the answer for that, please leave your answer in the comment section below. And these were the different options which are asked in this question. Marfan syndrome, these is going to have a genetic defect in the fibrillin, and in the case of Ehlers-Danlos syndrome, there is going to be a defect in the collagen biosynthesis, likewise in osteogenesis imperfecta as well. Okay, so I hope all of you enjoyed this explanation. Please do hit that like button, and this is tomorrow's MCQ. Please, if you know the answer for this question, type 414 followed by the answer whichever you think is the correct answer. Thank you so much.